On the other side of the coin, did you feel you had enough information about what was going to happen as a result of the operation? In other words, had you been given a chance to talk to other people about it or anything like that?
I was given the opportunity to talk to the nurses on the ward beforehand, and they came and spoke and said, you know, do you understand what's going to happen? And I said yes. And also a very nice touch that I thought was my consultant, Miss Shikui. She stuck her head around the door, and I know she's a busy lady and she got a theatre list to do that day, and I was just one of many patients on that list that she was dealing with. And some obviously were going to be small operations, some were going to be bigger and more stressful for her and the patient. And I thought it was very kind the way that she kept me in the room and asked me how I was and, you know, spoke to me, because that gave me some sort of reassurance that she was still there, that she'd got my best interests at heart, and that helped as well. And the anaesthetist, the same, was quite good like that, you know, and you know, had a chat with me about things. So yeah, in that way, that helped. Definitely.
What was your experience of the wards as a whole, being on the medical wards?
The medical ward I found was quite unusual at the hospital. Obviously they were all ladies in beds. I actually was in a side room off the ward which had pluses and minuses. In the end, because of something else that happened to me externally, it was a plus. But in the beginning I would say it was a minus, because you felt isolated. I was there with my thoughts for quite a long time and my worries. I couldn't go to another lady and say, hi, my name is Julie, and you know, are you having an op today and how do you feel, and I'm a bit scared. And we couldn't talk about our worries and things, and also you couldn't say that to the nurses. It was just a case that you were in that little room, and it was just really getting through that time until you could have your op and then see after. So in that way, that was a mixed experience for me, definitely.
Now you were discharged home, and
yes.
Then I wonder how long it was till you started to feel more like your normal self again after that big operation.
It was a very long time, I have to say. The surgery I had in my breast, when they showed me at discharge on the ward, the nurse took you into a room and took the dressing off and showed you the scar, the extent of the surgery. I was really frightened about that until I was actually shown. And then when I was shown, it wasn't too bad at all. It was a lot better than I was expecting. One of the problems I had was when I did get home and I was discharged, I was very fearful about the scar and getting it wet and showering, and more importantly, the scar I had under my arm, which was where lymph nodes were removed, was the most painful actually, and that was quite sore, and it just looked quite ugly, and to some extent I still think it does. But I was pleasantly surprised with the scar that I'd got, but it was very painful. And I must admit, when I got home, the first thing I thought about then was, oh, they've done the histology, the biopsy, they've taken the area out. Gosh, how bad is that going to be? How big is it going to be? What grade is it going to be? How serious is that going to be for me? And that became quite a big worry for me all the time. Yeah. So I would say it was a long time that you were torn between trying to be normal and people were trying to jolly you along and see you as normal, against your own personal worries there that you know you could share with people if you wanted to, but sometimes I think I personally was quite numb. I was in a numb state. I didn't know what to worry about first, really. Even though I know I was taking an important step to dealing with my illness, it was still very frightening, and of course there's delays all along.